Managing common symptoms safely, important OTC medications. Seasonal allergies, viral coughs, colds, and similar ailments impose a significant economic and social burden on communities globally. While most symptoms self-resolve within days to weeks, over-the-counter OTC medications help relieve discomfort safely for millions annually. This paper examines 5 major categories: non-steroidal anti-inflammatory drugs, NSAIDs, paracetamol, decongestants, antitussives, antihistamines focusing on ibuprofen, acetaminophen, pseudoephedrine, dextromethorphan, cetirizine, respectively. Importance of safe self-care. Acute respiratory infections alone cause over 291 million ambulatory visits annually in the U.S. With judicious OTC use as directed, individuals gain autonomy managing common symptoms, avoiding non-urgent healthcare facility flooding. Symptom relief leads to increased productivity and decreased absenteeism from work/school. Side effects are typically mild but can potentially impact susceptible subsets, necessitating medical guidance. NSAIDs, ibuprofen. Ibuprofen inhibits cyclooxygenase enzymes, lowering prostaglandin synthesis, decreasing pain fever through peripheral and central analgesic mechanisms. It works well against common symptoms within recommended dosage duration guidance. GI intolerance occasionally occurs, necessitating alternate options for vulnerable patients. Product labeling guides safe individualized usage. Paracetamol, acetaminophen. As a centrally acting analgesic and antipyretic, acetaminophen decreases pain fever signals in the central nervous system, effectively for common symptoms when used properly. A lower overdose threshold than ibuprofen demands strict daily dosing instructions adherence. Rare but serious hepatotoxicity necessitates avoiding acute chronic excessive intake patterns. Decongestants, pseudoephedrine. Pseudoephedrine, an orally acting sympathomimetic, constricts nasal blood vessels, relieving congestion by receptor-induced vasoconstriction. The decongestant effect provides nasal breathing improvements. Individuals with hypertension, diabetes, hyperthyroidism, psychiatric disorders require medical consultation prior to use due to potential side effects. Antitussives, dextromethorphan. As a non-opioid centrally acting cough suppressant, dextromethorphan reduces cough reflex sensitivity in the medulla, improving productive cough symptoms. However, therapeutic effects are modest at best, and the agent requires precautions in individuals taking monoamine oxidase inhibitors to avoid psychiatric adverse reactions. Antihistamines, cetirizine. Second-generation antihistamines like cetirizine competitively block peripheral H1 histamine receptors, decreasing symptoms from allergic rhinitis effectively when used properly. Side effects are usually mild and rarely lead to discontinuation. Precautions apply in those taking CNS depressants due to additive sedative potential. OTC medication complications. While self-limiting and uncommon when OTC agents utilized judiciously as indicated, potential adverse effects include GI irritation, ulceration, risks Shire with frequent, prolonged NSAID intake requires symptom monitoring. Hepatotoxicity reported rarely with supratherapeutic acetaminophen intake, demands strict daily dosing guidance adherence. Hypertension, tachycardia, seen occasionally with oral decongestant overuse, requires limiting duration to FDA recommendations. Sedation, impairment more problematic when CNS depressants combined with antihistamines like diphenhydramine, necessitating precautions. Drug interactions diminish efficacy, increase side effects, risks exponentially when OTCs combined, improperly demanding medical guidance prudently. Careful review of ingredients, instructions, contraindications facilitates safe self-care. Close medical follow-up addresses concerns for vulnerable subsets, judiciously weighing risks versus benefits. In summary, selective OTC pharmacotherapies relieve common acute symptoms effectively for most adults and children as directed. Side effects are predominantly mild but potentially serious in rare instances, necessitating moderation of dosages, durations, and precautions among vulnerable groups. Practicing self-care judiciously as indicated optimizes recovery and productivity safely long-term when medical guidance sought proactively as needed.